Indication: DIACOMIT stiripentol is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam who are 6 months of age and older and weighing 7 kilograms or more. There are no clinical data to support the use of DIACOMIT as monotherapy in Dravet syndrome. Important safety information. Contraindications. No contraindications are listed. Warnings and precautions. Somnolence. DIACOMIT can cause somnolence. Monitor patients for somnolence, particularly when DIACOMIT is used concomitantly with other CNS depressants or clobazam, which is also known to cause somnolence. Decreased appetite and decreased weight. DIACOMIT can cause decreases in appetite and weight. The growth and weight of pediatric patients treated with DIACOMIT should be carefully monitored. Neutropenia and Thrombocytopenia. DIACOMIT can cause significant declines in neutrophil and platelet counts. Hematologic testing should be obtained prior to starting treatment with DIACOMIT and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, or AEDs, DIACOMIT should be gradually withdrawn to minimize the risk of increased seizure frequency and status epilepticus. Risks in patients with phenylketonuria or PKU. DIACOMIT for oral suspension contains phenylalanine, which can be harmful to patients with PKU. Before prescribing DIACOMIT for oral suspension to a patient with PKU, consider the total daily intake of phenylalanine from all sources, including DIACOMIT for oral suspension. DIACOMIT capsules do not contain phenylalanine. Suicidal behavior and ideation. AEDs, including DIACOMIT, increase the risk of suicidal thoughts or behavior. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Adverse reactions. The most common adverse reactions that occurred in at least 10% of DIACOMIT-treated patients and more frequently than on placebo were somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia. Pregnancy. There are no adequate data on the developmental risks associated with the use of DIACOMIT in pregnant women. Based on animal data, DIACOMIT may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to AEDs such as DIACOMIT during pregnancy. Physicians are advised to recommend that pregnant patients taking DIACOMIT enroll in the North American Anti-Epileptic Drug (NAAED) Pregnancy Registry. Information is available at www.aedpregnancyregistry.org. This can be done by calling the toll-free number 1-888-233-2334 and must be done by patients themselves or their caregiver. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full DIACOMIT prescribing information at diacomit.com.